Boris, I just would like to add that Professor Malyugin is the president of the Russian Ophthalmology Society and well known around the world. Please welcome.
Thank you very much. So I will be talking today about the femtolaser-assisted technologies of limbal stem cell deficiency in limbal stem cell deficiency patients via epithelium reconstructive surgery. This is just to remind you the complex structure of the limbal area, which we know generates the limbal cells covering the cornea, and this layer is vital to getting the cornea transparent and completely clear. We know the XYZ theory, when epithelium cells that are generated by stem cells are migrating towards the center of the cornea from the periphery, and from the lower, deeper parts of the epithelium layers to the surface, and then exfoliated out from the superficial areas. And these are very nice pictures showing that the epithelium cells lines are colored in different stains, generates their own lines of cells like green, red, and blue that migrates from the limbal area towards the center and then covers the whole cornea. We know that limbal epithelium stem cell deficiency is a complex disease which is related to many congenital and acquired factors. Among those, we have to mention ocular burns and traumas and different long-term of use of medications. So corneal revitalization techniques depend on the laterality of the lesion, and we will be talking today about unilateral limbal stem cell deficiency that can be reversed by surgery or different regenerative procedures, and there are different methods of surgical procedures that were being introduced over these years, with probably the most widely used that is coming from India by Dr. Sangwan and co-authors who pioneered the simple limbal epithelial cell transplantation, or SLET technique, when the eyes, when the cells from the limbal area of the normal eye are transferred to the surface of the affected eye. Following that, the lens, the cells are glued on top of the amniotic membrane, and following that they spread and restore the function of the damaged and lost cells. And we know that it provides both anatomical and functional success in substantial amount of patients. Over 70% of patients regain their normal ocular surface, including pediatric cases and adult patients. So in 2020, we published the new variation of this simple limbal epithelial cell transplantation, which is called glueless, because the simple idea here was that we were not having at that time the glue that was appropriate for gluing the limbal fragments towards the cornea. So we decided, why don't we create the non-penetrating incisions on the periphery of the cornea, and to place these limbal microfragments harvested from the healthy eye into these non-penetrating tunnels thus creating a specific niche for epithelial stem cells that will be located in these tunnels. So here is the procedure. As you can see here, we are doing intraoperative OCT to verify the damaged area of the cornea, and we are excising now the pannus from the surface of the cornea, and sometimes the corneas may be more or less affected, so it depends on the lesion, of the agent, of the chemical agent that created this limbal stem cell deficiency. Some polishing may be needed to smoothen the surface of the cornea, and cautery is applied to avoid bleeding. So following that, we take the limbal piece, a limbal fragment from the 12 o'clock position of the healthy eye, and we fragment this piece into 8 pieces. Following that, the partial thickness tunnels are created, and these limbal fragments are introduced into these tunnels one by one. And usually this, at the end of the procedure, we cover the cornea with amniotic membrane and contact lens. So this is the latest publication that we have. We analyzed results of this procedure in 14 eyes of over 6 months, and you can see here that we have a good result, including full reepithelialization of the cornea in more than 60% of cases. In more than 32%, it was almost complete reepithelialization, but there were some failures, of course, that we were followed for another procedures that we've done. So obviously, with restoring the normal epithelium, we have decrease of the tearing, photophobia, and all other negative side effects and symptoms of the limbal stem cell deficiency. So this is the next technology. So we decided why to use these tunnels manually, and we created, with the help of the engineers from Zimmer, special software that help us to create non-penetrating corneal tunnels with laser, and you can see these tunnels created on the porcine eye in the radial fashion. So this is how the procedure looks like. We dock after removal of the pannus, we dock the laser, and we create the incisions with the help of this laser. And you can see on OCT, we can see the nice tunnels and the air bubbles inside these tunnels. We use the spatula to open these incisions and then implant the limbal fragments into these incisions one by one. And you see how on the OCT it's possible to visualize the incisions located, the fragments located inside the incisions. So these are some of the results, preoperative and postoperative view of the eye after 6 months post-surgical procedures. And this is case 1, case 2, case 3, and case 4, and there are many more that we have. So the next step was to avoid knife not only during the process of creating the tunnels, but also during the process of harvesting the epithelial cells. As you can see here, there is a niche of the epithelium stem cells in the limbal area where palisades of wax are located. This niche is 100 micron from the surface of the limbal area. So then we can program the laser and create a very nice and precisely controlled fragments with the laser. So this is a schematic representation of how the laser work, and this is the other software that helps to create these limbal fragments. And again, this is animation showing what was already being shown, how these limbal fragments are implanted into the corneal tunnels. So basically, this is how the software works. So after docking, we have exposure of the sclera and the limbal area, because there is a need to excise conjunctiva. And this is after laser. We remove the corneal scleral fragments one by one, because there are some adhesions exist in this area. This is one of the first clinical cases. You see, this is 2 weeks postoperatively. We have partial epithelialization, 1 month as well. So in 2 months, the epithelialization of the cornea was like 3/4 of cornea were already healthy, and this is 3 months postoperatively, and we see that there is a complete coverage of the cornea with the healthy corneal epithelium. So to conclude, it's an interesting area of research, and there are several techniques that are proposed to cure these patients. So there are different approaches depending on the laterality of the disease and the underlying conditions. However, we do think that femtosecond laser-assisted technologies are quite a viable option and help us to treat these patients quite effectively. And I thank you very much for your kind attention.
Thank you. Thank you.